Hi, this is Giuseppe Argenziano from Naples, Italy, and I would like to show you a few examples of what happened in the melanoma screening that we are facing every day after the COVID period, the COVID lockdown. And this is in some way in line with what I presented to you in the previous video. So this is again a proof that if we are not doing our daily job with melanoma, the prognosis of our patients will worsen a lot. Okay, so what happened in the melanoma screening after the COVID lockdown? What we did is very simple. We collected all the melanomas that we saw from March 2019 until today, so meaning from the day we started our lockdown in Italy until now. Okay, and this is a number of 340 melanomas that we saw in 10 months. And then we confronted these 340 melanomas with 340 melanomas that we saw in the 7 months before the lockdown. Okay, so the regular melanomas that we saw before. Okay, and what happened? We saw very interesting things. First of all, the number of in situ and invasive melanomas is basically the same. Okay, so you see 133 melanoma in situ in the pre-COVID period and 126 in the post-COVID period, meaning that melanoma in situ is more or less a different beast from invasive melanoma, from thick melanoma. Okay, so we have plenty of time to diagnose melanoma in situ. Therefore, the lockdown was not influencing too much the number of melanoma in situ we saw in the pre and post-COVID period. Okay, but what is the situation concerning invasive melanoma? Well, definitely we saw a substantial increase in mean melanoma thickness. In the post-COVID, the mean thickness was 2.2 millimeter, while in the pre-COVID period it was 1.6 millimeter. Okay, so you see that there is a significant difference in terms of thickness. But what was the also the final interesting thing we saw is that more or less the situation concerning stage 1 melanoma remained the same. So you see it's not pretty much different, you know, so the same amount more or less of melanomas in stage 1. Why? Because stage 1 melanoma, they behave still like a melanoma in situ, so they are growing slowly. So we, the lockdown and the delayed diagnosis was not influencing too much this kind of melanoma, stage 1. But the situation in stage 2 melanoma changed dramatically. These are the number of stage 2 melanomas discovered in pre-lockdown and post-lockdown, not too much difference. And not too much difference in terms of stage 2AB and stage 2AB pre and post. Okay, so it looks like there are more stage 2A and B melanomas in pre-lockdown than in post-lockdown. Why? Because most of the stage 2A and B melanomas that were delayed in terms of diagnosis went very fast into stage 2C, meaning more than 4 millimeter ulcerated. Okay, so the most severe form of melanoma that we know in our daily life. Okay, so can you imagine there is a difference of 11 cases from and 23, so the number of stage 2C melanomas doubled in the post lockdown period. What does it mean? It means that stage 1, stage 2 melanoma, when melanoma reaches 2 millimeter, 2 millimeter and a half, then it's going very fast. And even 3 months of lockdown are able to change dramatically the prognosis of this kind of melanomas. And these are examples of the melanomas we saw in the last 10 months. You see, these are horrible melanomas. Melanomas that if we were able to diagnose 6 months before, suddenly the situation was a little bit better. Okay, so again, what we do in our practice in terms of melanoma screening is worth. We should not follow the suggestion of the paper published recently in New England Journal of Medicine that we should basically stop screening patients for melanoma. We should stop using dermoscopy. We should stop doing biopsies of lesions of less than 6 millimeter. But we have to continue doing like this, because if we do like this, we will decrease the number of melanomas which are going to be very thick and bad.